Hey guys, starting for you this 5-minute series in which we are going to discuss very important MCQs of AIIMS and NEET PG. This section focusing over preventive and social medicine. A dream does not become reality through magic. It takes sweat, determination and hard work. If you want to win or to achieve your dream, you cannot quit at this halftime. You cannot quit in this mid-season. Make your story in such a way that it is inspiring to everyone. Someone who refused to give up and who refused to settle. Keep going, your future is waiting for you. So, this is Dr. Shivam, and starting with the series, longitudinal studies are done for identifying the risk factor of disease. Incidence rate can be calculated by prospective studies, while the cohort study gives the attributable risk and the relative risk. Okay, so sometime we get asked for what this incidence rate and from how this attributable risk and relative risk can be calculated. So cohort for relative and attributable risk, and prospective is for incidence rate. Also, case control means already disease has happened, that is a study of a person who has already contracted disease is case control, and odds ratio can be calculated by this case control study. So these are 3-4 important MCQs: odds ratio, case control study, cohort is relative risk and attributable risk. Now, selection bias is eliminated by randomization. Missing cases are detected by sentinel surveillance. The first step in investigation of any epidemic is confirmation of the diagnosis. Again, a repeated question. Secular trend refers to gradual change in particular direction. Secular trend is best demonstrated by line diagram. In an epidemic, the first case to come to the notice of investigator is index case. Secondary attack rate is good measure of communicability of the disease. Now some one-liners like theory of web causation was given by McMahon and Pugh. James Lind is related to the discovery of prevention of scurvy. Gap in time between entry of organism and appearance of sign and symptom is incubation period. When disease enters and first symptom appear is known as incubation period. Time between entry of organism and to produce maximum infection is called generation time. So do watch the difference between generation time and incubation time. Serial interval is the time between onset of primary and a secondary case. Okay, so all are important: serial interval, generation time, incubation time. Epidemiology can be defined as a study of distribution and determinants of frequency of disease in human. Study of time, place and person is known as descriptive epidemiology. Don't take it lighter, everyone is a MCQ already being asked. Prevalence of disease can be assessed by cross sectional study. Okay, prevalence by cross sectional, incidence by prospective study. Contact with hospital personnel is most common mode of transmission of nosocomial infection. Diseases which are imported into country in which they do not otherwise occur is called as exotic diseases. TT is the most efficacious vaccine. Adjuvant use in DPT is aluminum hydroxide, very common. Normal saline is diluent for BCG, common. BCG vaccine is administered intradermally. WHO recommends Danish 1331 strain for BCG, very common. Immunization against Hep B is included in WHO in immunization schedule. Neurological complication rate is 0.5 per 1000 with rabies nervous tissue vaccine for Hep B. Live vaccine is yellow fever, that is the yellow fever vaccine is a live vaccine. Acetone killed typhoid vaccine. Immunity lasts for 3 years. Immunity develops in 30 days after the administration of JE vaccine. That means if someone asks you a question, asks you In JE, the immunity develops after how many days of its vaccination? It is 30 days. Okay. Now, yellow fever vaccine is valid for how many years? Answer is 10 years. 17D is a live vaccine. MMR is what type of vaccine? Live attenuated vaccine. Vitamin A prophylaxis is an example of a specific protection. So this specific protection, primary protection, and different examples, very important. Vaccination against disease is an example of a specific protection. Iron and folic acid supplementation, many people confuse it during exam. It is a specific protection. Primordial prevention deals with individual without risk factors. Decks provided with tabletop to prevent neck problem in an example of primary prevention. Screening of diseases, secondary prevention. ICD-10 has 22 chapters. PQLI includes IMR, life expectancy at 1 year, and literacy. Okay, so also read these different types of indexes. These are important. Now, one last quote that, so this is something from Michael Jordan, who says that he has failed over and over and over again in his life, and that is why he is a successful person now. So learn from your failure and strive for the best. This is Dr. Shivam. Stay cool, study hard, stay motivated, and do whatever you want. Thank you.